Hi, my name is Ikoya Ogumi and I'm the founder of Sane Mind. Sane Mind is a mental health advocacy organization that provides mental health information and services. We're particularly honored to be a part of Famsa GA 2018 because we are interested in building capacity for mental health and building capacity for the healthcare system in Nigeria.
I am Dr. Lupenga Uwele. I am the Head of Clinical Services, Plenary Psychiatric Hospital, Yapa, Lagos. I am here to attend the Famsa General Assembly.
My name is Ibrahim Badejo. I'm from Johnson & Johnson Innovation in Cambridge, Massachusetts. And the reason I'm here is to support Famsa. I see highly energetic medical students that really want to do greater things in Nigeria. And it is my privilege and honor to have Johnson & Johnson as an organization to support this endeavor.
It is indeed a great pleasure to welcome you all to day 3 of the 32nd Famsa General Assembly. My name is Chinedu Waduru and with me is... Alright, may we rise to take the national anthem, please. Very much. You may have our seat.
Welcome once again, ladies and gentlemen. This conference for me has been very educative and of course entertaining. I'm very sure all the delegates are testing this fact. I cannot believe this is the 3rd day of the conference. I can't believe this is the 3rd day of the conference. Sadly, this event is gradually coming to an end.
Very true, Dasla. Yesterday we had 2 enriching sessions on infectious diseases in Africa. Are we really winning? And the burden of NCDs taking a quantum leap. And we had really interesting comments on Twitter from both our esteemed delegates and speakers.
Yes, here's Odeyemi Deborah saying, surveillance system, healthcare funding, health-seeking behaviors, antibiotic resistance politics. There's a lot to combat if we are to win the war against infectious diseases, medicines, and more.
And from the office of the officer in charge of WHO Nigeria, Dr. Clement Lugala, he said, being part of the Federation of African Medical Students Association's General Assembly shows me that Africa has a future in the healthcare sector. Congratulations, #Famsa, and thank you for having the WHO team.
Here's another from Tolu Wanimi. This conference has been too good not to be impactful. I really hope position papers and evidence-based reforms in Africa's healthcare system stem from this. Great stuff.
And lastly, from the WHO Regional Director herself, Dr. Matshidiso Moeti, saying on her Twitter handle, African medical students are the future of health on the continent. I wish you a fruitful 32nd General Assembly, and I look forward to hearing the outcomes of your deliberations. So there you have it. You can join the buzz by using the hashtag FamsaGA 2018.
And you can equally download the conference app. Kindly download the WOVA app from your Google Play Store or Apple Store and search for 32nd Famsa General Assembly and join the other delegates.
Yes, and right about now, we will be replaying the welcome address from the WHO Director General. We sincerely apologize yesterday that we were not able to play it due to technical difficulties, but now our technical team are ready and will be taking the address from the WHO Director General in person of Dr. Tedros.
Ladies and gentlemen, thank you for inviting me to speak to you today. And I'm really sorry I can't be with you in Ibadan. There is no healthcare without health workers. Doctors, nurses, midwives, and other health workers are the backbone of every health system. But we know that if current trends continue, the world will face a shortfall of 18 million health workers by 2030, including 6 million in the African region. To achieve universal health coverage and the Sustainable Development Goals, we need two crucial reforms. First, we must urgently address the mismatch between the education and training of health workers and the health needs of populations. And second, we must refocus health services and health workers on delivering primary health care that puts the needs of people first. As African medical students, you have a great opportunity and an even greater responsibility. You can count on WHO to defend your rights, to give you the tools you need to do your jobs to the best of your ability, and to support you to meet growing and changing population needs. But your role goes beyond the individual patient. You must also be advocates for health and for action to address the causes of disease that lie outside the clinic. So I urge you to use your talents, your opportunities, and your voices, not only to treat and heal, but to advocate for a fairer, safer, and healthier world. Thank you for your commitment to serving humanity. I wish you a successful meeting. I thank you.
Thank you. And we thank you too, Dr. Tedros. Today promises to be a lot better. We get better and better every day. Today's plenary sessions are on maternal health, breaking the silence, and mental health, breaking the silence, and maternal and child health in Africa, the wages of disconnect. I repeat, mental health, breaking the silence, and maternal and child health in Africa, the wages of disconnect. The truth is, I really can't wait to get down into these plenary sessions. What about you, Dasla?
Sure, I definitely cannot wait to. I look forward to learning a lot, especially on mental health, from our seasoned panelists. It's a field I'm somewhat keen about.
Yes, I think now in Nigeria, a lot of people are talking about mental health. Even amongst medical students, you see a lot of breakdowns, suicidal ideations. So I think this particular plenary session will shed more light and help us, guide us into taking better care of our mental health. So without further ado, our first plenary session today will be moderated by pharmacist Rukayat Ogumbi. Now, pharmacist Rukayat Ogumbi, she is the founder of Sane Mind Advocacy Organization, which is a mental advocacy created to fill the paucity of information and services around mental health in Nigeria.
She obtained a master's degree in child and adolescent mental health from our very own University College Hospital, Ibadan, where she received 5 awards of excellence.
Very true. And Rukayat Ogumbi, with her wealth of knowledge, trained over 100 teachers in Lagos State on early signs of mental health and created parenting and school mental health programs aimed at promoting mental wellness in children and adolescents.
And when she's not doing all this, she curls up on a sofa, watching DIY videos on YouTube in a cold room. Wow, I should try that sometime too.
All right then, ladies and gentlemen, with a warm round of applause, please welcome pharmacist Rukayat Ogumbi. Keep clapping. Thank you so much for coming. And just, Dassler said I should tell you to please send her some of the videos. Yeah, when you're done. Welcome.
Thank you very much. Thank you so much for that warm welcome. Thank you, University of Ibadan. How do you call yourself? Federation of, how do I say Famsa? Okay, Federation of African Medical Students. I'm so grateful to be here, and I'm super proud of you guys for doing this. So I will be introducing my panelists. We have 3 people on our panel, and it's going to be wonderful. So starting with Dr. Waniki Kivwanga. I hope I pronounced that well. Did I? Okay. Dr. Waniki Kivwanga holds a first degree in medical MBBS, an MPH and PhD, and is the Global Execution Lead, Mental Health and Special at Johnson & Johnson Global Public Health. Dr. Waniki Kivwanga is a medical doctor, a public health specialist with more than 15 years of experience in clinical practice, public health, and public health program management, as well as clinical and operational research with focus on maternal, newborn, child health, HIV and AIDS, TB, mental health, health policy, and healthcare management. I'm sure you know that this person's full with a lot of resources that you can drain from. Also, Dr. Waniki has leveraged his skills to support diverse projects across multiple organizations. From 2004 to 2010, he was a senior medical research officer at Kenya Medical Research Institute, Plenary. Did I get that right? Dr. Waniki, did I get Plenary right? All right. From 2010 to 2016, he worked on various large-scale health integrated projects from diverse organizations, including USAID, DFID, and UNFPA. Mental health/mental illness may affect 1 in 4 individuals in their lifetime. Importantly, nearly 80% of persons with mental health in resource-limited regions may never access appropriate health. Changing this narrative is very prominent for them at Johnson & Johnson, and he's passionate about this and is looking forward to discussing all of this with you. Please welcome Dr. Waniki Kivwanga. Am I not supposed to introduce all of them? No, after his okay. Please have your seats. Thank you. Thank you. Also on the panel, we have Leilani Mary Oluwatosin. Leilani Mary Oluwatosin is a clinical virologist with specialization in the use of molecular biology techniques in studying viruses. She volunteered with Educate Africa, where she mentors adolescents, after which she gained experience as an enumeration officer and a water quality tester in corruption survey with UNODC and MICS5 survey with WHO/NBS respectively. In 2016, on recognizing the rising incidence of depression and suicide in Nigeria, she founded a mental health awareness initiative called Smile Again, aimed at building strong support systems, raising awareness, and eradicating the stigma surrounding mental health disorders. She has organized awareness outreaches across selected secondary schools and tertiary institutions in her community. She has also reached out to individuals across the Smile Again platform and collaborated with mental health professionals, with the goal of raising a community of mentally aware individuals who can provide first-aid mental health solution with their immediate cycle, friends, family, and colleagues. Mary plans to build a stronger and wider social media network and also collaborate with mental health professionals, non-governmental organizations, health institutions, and establish mental health work in centers. Today, she's going to be sharing with us all our works with community and individuals living with mental health problems. Please welcome Leilani Mary Oluwatosin. Also on this panel, we have a seasoned psychiatrist. He's going to be representing the Chief Medical Director of Federal Neuropsychiatric Hospital, Yaba. This is in person of Dr. Olubenga Adekile Oweye. Dr. Olubenga Adekile Oweye is currently the head of clinical services of the Federal Neuropsychiatric Hospital, Yaba, Lagos. He has a Bachelor of Medicine and Bachelor of Surgery from Obafemi Awolowo University. He obtained a fellowship of the National Postgraduate Medical College of Nigeria in 2003, Masters in Clinical Psychology from the University of Lagos in 2005, Master of Philosophy in 2016 from the University of Ibadan. He has attended advanced management courses, administrative staff from the Administrative Staff College of Nigeria. He has over 20 research publications to his credit. I think that should get an applaud. 20 research publications to his credit. He has attended many conferences locally and internationally. His areas of interest in research include substance abuse, general adult psychiatry, and psychotherapy. Please welcome Dr. Aweye. Welcome, sir. Okay, so we're going to be having a short keynote speech from Dr. Waniki Kivwanga. I make conscious effort to make sure that I pronounce that name well. So we're going to be having a short lecture from Dr. Waniki Kivwanga, after which we'll have a short video introducing the topic of discourse. I hope you have a lovely time. And Dr.
Thank you. Thank you for that extensive introduction. And of course, the team at Famsa. It's great I could make it. I almost never made it, but thank you for a very well put together conference. I was about to finish, but I've not finished. I also want to thank the entire city of Ibadan. Yesterday I had Amala for the first time. And pepper soup. And I washed that down with pepper soup. Oh. Beautiful, beautiful. So I'm only waiting to eat fufu today, and then I'll have had a good share of Nigerian experience. I will not chop money. So, before I start, I would want to ask us to take the next 15 seconds of my 10 minutes to just be very silent and look at that picture. It's time? So, wonderful. So, the topic we are talking about today, it's a topic we have shied about talking for decades, and not just in Africa, but across the world. So we are not just talking about breaking the silence. We are really talking about breaking the silence to break those chains that keep many of our people in bondage, literally. So, good. So, the moderator already went through an extensive introduction, so I will not spend any more seconds introducing myself. I'm just said my experience so far is wonderful, and it's always great when organizations led by young people approach us and say, can you support us? And you have to take the leap of faith and say, these guys know what they want, and they can turn that support into something tangible. So thank you again for what you have done. Where do I press? Where do I point for this to move? Ah, perfect. So, Why do we want to break this silence? What really, why does it matter? Many people, we have been silent for this long. Why does it matter now? So what is the cost of our silence? The cost of our silence is this. 1 in 4, so look around, count yourself and the next 3 people are most likely going to suffer from some form of mental illness or an issue that requires mental attention in our lifetime. That's how big it is. Is that big or is that small? 1 in 4. In other words, 25% of us. So either you, a friend you know, a family you know, and above all, the cost is close to this, and it's right, 16 trillion. Let's convert that to Naira. Can we? $16 trillion converted to Naira, that's the cost of ignoring the burden of mental illness across the world. And the burden is even higher right here. Remember, most of that burden, 75% is among people, young people, people just coming to their prime, people who are just maybe finishing college, where you want to reap the benefit of the demographic value of that person. So 16 trillion translate that to a disease or condition starting at an early stage when you should be reaping the demographic dividend as a nation. Only 80%, let me put it, only 2 or less than 2 out of every 10 of persons with mental illness in our setting, that's sub-Saharan Africa, lower income countries, ever access any form of formal health care. So where are they? They're in those chains that we saw there. 10 to 20% of those, when 80%, 10 to 20 years of life lost. In other words, early mortality and morbidity across that group. So it matters from an economic perspective, from every kind of work. The only other disease that we have seen knocking off 10 to 20 years of people's life is HIV/AIDS. And if we could do something about that, then it's time we refocus and do something about mental illness. So let me just restate what I'm saying. 3 out of 4 people living with severe mental illness are in our region, are in low, middle income countries, are in sub-Saharan Africa. Only 1 in 50 are accessing any form of healthcare. In other words, our healthcare system is yet to style up and start looking to how to take care of these people. And of course, the reasons are obvious. There is no money. Less than 1% of our healthcare budgets across many countries in Africa is spent on mental illness. So that picture will not change unless we change a lot of things. So can we break the silence? Yes, we can, but we cannot do it when the infrastructure is in a vacuum, when we have no care infrastructure for our people. When you talk about mental illness, this is a disease whereby, yes, you are talking about the individual, but very quickly, you are moving from the individual to the care system, i.e. the family, the community they come in. It's going to touch everyone. You get somebody in your family today with a severe mental illness, be it schizophrenia, be it bipolar, be it depression, be it even simple continuous anxiety. That person relies on the entire healthcare system. You may even have someone dedicated to take care of them 24/7. And if there is no such a person, you will put them in the chains we saw. So the implication is across the entire community, from the person to the community they live in, to the country, to the region. And therefore, if you are talking about breaking the chain and breaking the silence, you must think healthcare system. There must be leadership, because if you are saying 1% of our budget, and I hope our leaders are here today, and we are all leaders very soon, if 1% of our budget is going to mental illness, we can talk about breaking the silence, but it will just be an empty talk. We must follow that with serious commitment that bear down and improve the entire healthcare system, from financing to the right treatment to the right human resource for health to take care of that gap. So this is not new. What we are saying is that all the building blocks that WHO has advocated for over the centuries need to be brought to bear for us to be able to break the silence. So one of the things that we did through WHO is come up with a mental health action plan, 2013 to 2020. And by 2020, we committed to 4 big things. First, we said we want every country, at least 80%, if not 100, to have updated their mental health policies and strategies to be able to drive action. Well, where are we? As we speak, in the last progress report, about 1 or 4 have done this. We said they need to follow that with updating the actual laws that govern and articulate how to handle people with mental illness to ensure they access care. They are not discriminating by health insurances, and so on and so forth. Only 50% or so of countries have done that. But then, policy and laws can go only far. You need to follow that with actual programmatic implementation. And that's where the big challenge is. We committed that by 2020, we'll increase healthcare services for mental illness by 20%. Right now, the data we have suggests we are far off that. And above all, we are hardly monitoring and evaluating our mental health programs, maybe because we have not yet set them up. So there's a lot to be done in the next 2 or so years. And most likely, many countries in our region will miss all the targets, or most of the targets that we want to achieve by 2020. So how do we change that? The first thing is, we cannot ask people to pay out of pocket for a very serious condition. When you're talking about mental illness, you're talking about a very serious public health issue where most of those people, first of all, will either get fired or stop going to work because of the condition. You have severe depression. You can hardly get out of bed. So the first thing we must change is this picture, where almost 70 to 90% of our healthcare is out of pocket. If you have no money, you have no healthcare. That must be changed. So where is Nigeria? Maybe we should see. So one country that I say has done a lot of this will need a mixture of how to handle health insurance, including community-based insurance schemes for the very low underserved populations who cannot pay top dollar for high-level insurance, at least to ensure they access the very basic care, including mental health care. So in summary, we want to break the silence, we must accelerate the momentum. We must bring in our leadership to bear and commit to supporting mental health. We must elevate the patient. We must learn from history. When we talked about TB, we talked about HIV. One thing that we are able to do is really elevate the patient. In every room, in every policy discussion, you could hear the voice of the patient. In every international conference, the patient will talk and say, you must look at us in the eye and say, why are you letting us die? We must do the same for mental illness. I hope next time, especially in a forum like this, we'll have someone who has lived through this to actually talk the real stuff. We must follow that with serious reconfiguring of how we want to fund mental health care, globally, regionally, nationally. We must integrate our services. As I said, this is a healthcare system issue. When we talk about TB, HIV, maternal, newborn, and child death, let's integrate mental illness into there. We must bring our partnership to bear. And this is so key. Be they public-private partners like us, Johnson & Johnson, government entities, NGO, actual patients. So, I want to end my talk by saying 1 or 2 things about Johnson & Johnson Global Public Health. So for many years across the century, we have had 2 big arms. Let me just go back a bit. We have had our core business, and we have had our philanthropic arm, the Global Communities Impact. And this has served us well for many years. But from around 2012, we said, if we want to support healthcare in resource-limited, 50% of the world, we must think of a different model. And that's how Johnson & Johnson Global Public Health, where I'm currently working, came into being. And the vision of this approach is that we can do a few things. The focus is TB, HIV, but today it's mental health. But the vision is we can do a few things that uniquely a company, and which is one of the biggest, actually the biggest healthcare, can do. We can bring our extensive research and development capabilities to address unmet needs, especially when you talk about mental health. What is happening in our brains is one of the areas of that requires continuous research if you are to get new treatment with fewer side effects that are more tolerable. A lot need to be done there. We can combine that working with partners to craft very innovative access programming around those disease areas. And therefore, we can deliver sustainable innovation to people who really need it, not just to the first half of the world. And that's really our vision, that working especially in the field of mental health, we can work together with you guys, young leaders of, and you said you are the healthcare leaders of tomorrow. No, the past, the present, and the future are a continuum. You are here now, you can start talking. You can break the silence. You can be vocal. Thank you.
Okay, I think this is better. All right. Thank you so much, Dr. Kivwanga, for such wonderful presentation. And just before we begin our panel session, we're going to be watching a video put together by the Famsa GA. Are you ready for us?
July 2018, Africa lost a giant, an academic, a researcher, an amazing leader, Professor Bangoni Mayusi. Moment of silence. According to his family, he had struggled with depression in the previous couple of years. The result? Suicide. Experts say that 1 in 4 Kenyans is likely to suffer from a mental illness at some point in their lives. The World Health Organization estimates that only about 10% of mentally ill Nigerians have access to a mental health worker. Many others, like late Professor Bangoni, suffer from the hands of mental illnesses. Many whose names never get to sit on the white pages of our newspapers, but whose lives stand as indicators for action. Silently, mental illnesses are becoming an epidemic in Africa, particularly at a time when little is being said and even much less done about mental health in the region. Despite the fact that mental illness ranks amongst the top 5 contributors to global DALYs, only a meager percentage of the paltry health funding in most African countries are allocated to mental health. How can we raise awareness? How do we begin to break the silence on this issue in our countries? How can we tackle the challenges in mental health? In this panel, we will be addressing these issues. We hope to stir up deep concern and a willingness to act on these problems in our countries. Remember, silence in the face of evil is evil itself. Let us break the silence. We are Africa.
Thank you for that wonderful video. So we're going to be starting this session, but I would like us to start with the challenges of mental health problems in Africa. The challenges of mental health problems in Africa and how it impacts on us as a continent, given that we are a largely youthful population, and from those statistics, the young people, 10 to 24, are actually the largest. They're the ones that have. So as a continent, we know that we are the largest youthful population at the moment, and we are expected to continuously grow. And given that mental health problems affect young people, they're the ones who feel the greatest of disability when it comes to mental health problems. And we know all the statistics. What are the exact challenges that we face? So maybe when we know our problems, we can begin to provide adequate and culturally evidence-based solutions to them. So I'll be starting with Dr. Weyer.
Thank you very much. I will take it from the first challenge that we face in Africa. One, how many people knows about mental health? What do we mean by mental health? We all know what health is. But what is mental health on its own? Okay? It's not just merely the absence of mental illness, like the way people see them on the street. No. If you can see from the presentation of the first speaker, 1 out of every people have one diagnosable mental illness or the other. So mental health is a state of well-being that allows 4 things in you. If all these 4 things are not present in an individual, that person is actually suffering from mental illness. Number 1 thing, the ability of an individual to realize his potential. That is the first thing. Once an individual is not able to achieve this, then his mental health is deficient. Number 2, the ability to cope with the normal stresses of life. You have stressors on daily basis. To what extent are you able to cope with it? If this area is deficient, then the mental health of that individual is deficient. Number 3 is the ability of the individual to work productively in wherever the person finds him or herself. If the person cannot function in this area, then mental health is also having a coma. Then lastly, the ability of the individual to contribute meaningfully to the community. So you can see from these 4 perspectives, mental health goes beyond merely the absence of mental illnesses. So most people don't even know, because when we say 1 out of every 4, people will look at it and say, out of every 4, that means 1 person has 1 challenge or the other. So the moment people are aware of this challenge, then the person will be able to really tackle his mental health problem. Secondly, the second challenge is the burden of the mental health. Like we said, 1 out of every 4. And out of this, only 80% of them, more than 80%, don't even have access to mental health care. And even those who have access to mental health care, they don't even have adequate mental health care. And there are a lot of factors responsible for this challenge. Lack of facilities, lack of manpower in various areas, because we have 5-member team taking care of the mental health care. Now, for example, in the area of manpower, as a medical student, how many months do you spend in mental health posting or in psychiatry posting? Psychiatry is not a major rotation during the internship. I hope you agree with me. So, and when we continue like this, the challenge will continue. Those of us who found ourselves in mental health, we just saw one role model or the other before we went into it. So the challenges are quite enormous. What about funding? Like the first speaker said, only, in fact, the mental health budget is the last to be considered out of the health budget. So the challenges are quite enormous, and to even worsen the situation, as we are producing the little number of mental health professionals, the psychiatrists, the clinical psychologists, the little that we are even producing in Africa, because of lack of job, they move out in droves. So the challenges are quite enormous. And even the medical students, they don't even have much exposure to tackle this problem. And that is why there is need for us to address all these challenges by breaking the silence. Thank you.
Thank you, sir. One of the key things Dr. Weyer said that really struck me is the separation of physical health from mental health. We seem to think like, mental health is so separate, physical health is so separate. But then the body and mind, they are the same. So this takes me to the next question that has to do with how do we begin to integrate mental health problems or mental health care into physical health care, which already has a structure anyways? How do we begin to integrate it so that at least maybe when a person visits a general physician and they're able to express the what they feel when it comes to mental health, they're able to get at least first aid, psychological first aid in that encounter. I'm going to be speaking to Dr. Kivwanga. You see, I consistently make conscious effort to pronounce your name.
I'm so close to... So thank you. I think that question has two dimensions. The first dimension is when we say people with mental illness, 10 to 20 years of their life is knocked off. A lot of that is because they suffer themselves from serious physical conditions. So A, it could even be from the drugs, A, from the inability for self-care. One dimension, that a person with mental illness, you need to pay very close attention, not just to their mental well-being, but to their physical other aspect, from diabetes, obesity, hypertension, all those things. The other dimension is what you say, that when I walk into your clinic, I could be coming for something totally different. I think I have a headache or I have hypertension, but I could have serious underlying mental illnesses that you need to be attuned to also pick up and support and over holistic care. So we must look at that in those two dimensions. And that is why there is a great need that general practitioners across the system, physician, not just the specialist psychiatrists, but physician, nurses, physician attendants, clinical officers, whoever, also are attuned to how to really speak up mental illness as they work on the physical sides. And just to piggyback on one of the things he said, we may need to think of what human resource we need to unlock our treatment gap for mental illness. And one of the cadre that I think will really move this forward is A, the general practitioners, and B, the specialized cadre of psychiatric nurses, not even the psychiatrist. And those will be, I think, the missing key. But that's human resource. That is financing. That is the 1% financial budget that we must work on.
I totally agree with that. The WHO actually have put in tax shift and tax sharing policies in place for low to middle income countries, where there are new cadres that are formed. In Ghana, I think there's community mental health workers. Then here in Nigeria, community health workers are being trained. I am well aware of what is happening in Lagos. I don't know what's happening here. And general practitioners are being trained. But I think we just need to do more. With time, we're going to get there. Okay, so I'm going to be asking another question that has to do with integrating. So these two people, Dr. Weyer is from the psychiatric hospital in Yaba. Dr. Kivwanga. Yes. Dr. Kivwanga is from Johnson & Johnson. These are established institutions that provide mental health care, mental health solutions. How do they now get to us? Because Johnson & Johnson would not get to me or you, and psychiatric hospital, personally, I know that they would not be able to get through to individuals on the streets. That's where we need community programs and NGOs. So how are you able to work in partnerships with these wonderful organizations to be able to deliver mental health awareness and then linkage services, which is actually very important to members of your community? Are you sure it's working?
Thank you very much. Thank you very much. The first thing I'm going to talk about is, you talked about linkage. So I'm going to talk about social media. That's the first thing I want to talk about here. And the social media is a very powerful tool and can be used, can be very, very, can serve as a very, very powerful tool for awareness in mental health. For example, now we have a lot. Everybody actually has an opinion. Everybody has their opinion on social media. So they just go there and they post it. Whether it's accepted, whether it's right or wrong, you just go there and drop it. So there's a need for us to correct the wrong opinions and the negative impressions that people have about mental health
through the social media. And since that is where most people see a lot of things, where you correct it is actually on social media, so that people don't have the misconceptions about mental health. And even reaching help and getting access to these NGOs is all on social media. So now we have things go viral, and everybody knows about it. You have millions of views, you have thousands and thousands of people, millions of people, billions on social media. So I think that the social media today is a very powerful tool in reaching out to people, in raising awareness for mental health, and also in providing the necessary support systems for people and making them know where they can get help from, making them know about these organizations that they can reach out to. You'll be amazed at the number of misconceptions we have out there. And because there's no way, you can't actually stop people from posting, so you see people just post a negative idea, or you post something that is so wrong, and you have a lot of people reading it. So the best thing, social media as a powerful tool to correct all these misconceptions. Another thing I'll talk about is raising awareness at different target groups. So you have secondary schools. Majorly what we've been doing at Smile Again in the past few months has been raising awareness and educating secondary school students about mental health. And I realized that it will amaze you how much these children know that you don't know that they know. You understand? And they ask very intelligent questions. They have so many misconceptions about mental health. So it's very important that from that stage, we begin to bring them up with the right information so they don't get to hear the wrong things from out there. So raising awareness at different target groups, secondary, tertiary institutions, let people understand, because like he said already, the first people that the support systems are usually the friends you have around, your family and everything. So I believe if we can educate the people around, educate your people in your social cycle, family, friends, when they have the right answer, they know the right answer. They know what to say and what not to say. When you educate these people, you can have immediate, the right immediate support system. And just like you mentioned, first aid, the people you have your first contact with, your family, your friends. If you have if they bring the wrong reactions, for people who have the mental health disorders, if they get the wrong reactions from these people, it's like you've already messed up the first line of receiving help. Can I go ahead? Okay. I think that another way that established bodies like this can pass the message across is through imbibing these messages, awareness programs, and in activities that we youths and everybody naturally likes to engage in. So talk about movies, talk about art, talk about music. I think that mental health awareness should be brought into all these activities, because people naturally love these things. So imagine a movie is trending now, and yesterday I was talking to a movie maker, and he was talking about creating movies, and we discussed about creating movies on mental health. It's a very powerful way of passing this message across, because once it's interesting, people like to see movies, they go to the cinemas, they watch it. So you imagine a movie on mental health that has a lot to pass across. It's educative, it's fun, it's also interesting. So you don't have to go through so much stress trying to make people watch it or trying to make people listen. They naturally watch the movie already, and somehow you've passed your message across. So that's another way of passing it. Thank you.
Indeed, incorporating mental health awareness into our general lifestyle is going to make a whole lot of difference. In fact, I like to make a similitude with HIV. Remember at the time when HIV, in the early 2000s, when there were lots of campaigns around HIV, there were music. I remember this particular one, Z-Pop, I can't remember well, but I know there were lots of media partnerships between different organizations who naturally may not have done that. And that is very wonderful. But then, When we want to talk about mental health problems, it is easy to reach people in structured environment. So for example, it's easy to go to secondary school, but then Nigeria has the highest number of out-of-school children, for example. It is easy to say that you want to go to tertiary education. The gap between school enrollment and then educational attainment is a whole chunk of 50% from primary school up until tertiary education. So what are we going to be doing for people in our rural communities, people in our urban slums, who most likely have higher predisposition to mental health problems, given that social circumstances are the greatest cause of mental health problems? Dr. Owoye, you want to say something about that?
Thank you very much for that question. And actually, we need to do more if we are to integrate mental health into the treatment of the physical condition. For example, since 1991 in Nigeria, there has been a policy in which the 9th component of the primary health care in Nigeria is actually mental health. Up till now, that is still remain on paper. The implementation is yet to be done. Actually, for us to be able to do this, we need to integrate mental health into the primary health care centers. The dispensaries, the health centers, they are supposed to be mental health professional caring for these people. And there are two ways we can do this, either by linkage system or by enhancement system. By enhancement system, we can train those people who are there. Those who are there, the basic way of recognizing small or minor mental conditions, what to do before referral. Another thing is for the mental health professional to be going there to go and actually attend to people. But how many of us in Nigeria? As of now in Nigeria, we have only one psychiatrist to about 1 million people. So to what extent can I take care of 1 million people? It's even worse on the part of the clinical psychologists. Talk less of the psychiatric nurses. Talk less of the social workers. So there is need for us in Africa to integrate mental health services into our primary health care system. This will bring the treatment services closer to the people. Those people in rural areas where we have the health centers and everything, people will have access to it. And this will go a long way to really help our people. But again, the manpower. Until we tackle the issue of the manpower, look at the curriculum in the medical school, because most new doctors that come out, they just have some knowledge about caring for these people. They will just refer quickly once they see a major mental disorder. So this should not be so. So we need to take care of the manpower, and we should encourage medical students to take up this profession. Because as of now in Nigeria, we are less than 200. And I know that in other African countries, in Kenya, there are very few. In South Africa, there are very few. So people don't go into it. Maybe because there is no money or because of the stigma. I want to encourage you people to go into mental health. Thank you.
Okay, guys, are you going to be taking your residency forms in psychiatry going forward? To be honest, I actually find psychiatry to be very interesting. Oh my goodness, I partially most times push my sister that please go to psychiatry. If there was one thing I could do was go back to medical school and then do psychiatry. Psychiatry is too wonderful for me. It's too beautiful a field that I believe that many people should learn more about it. And besides, if you will be giving holistic care, you actually have to have a major understanding of how all these things work. So we are going to be taking questions from the audience now, and I'm sure that you have lots of questions for us. So we're going to be doing like fastest finger kind of thing. Oh my goodness. All right, so are we going to be having a moderator for that, or I do it myself? Is there an usher that can help me pass the mic around? Is this one working? Okay. Do you have a mic there? Okay, great. So we're going to have rules of engagement, lest someone decides to have a paragraph as question. So you are going to ask one question.
Sure.
You are going to, okay, you're allowed to make comments. Of course, you should be able to make comments. So you have one question. Each person has one question. You can duplicate yourself if you have plenty. All right, first person. How do we do this? Do you answer immediately or we collate all the questions? Would you like to collate everything? Okay. All right, let's go.
My question is to...
We can't hear you well. Here.
Good morning. Yeah, my question is about prevention. We have discussed a lot about the treatment and providing services to people who have already succumbed. What about prevention, especially with the Johnson & Johnson? The WHO action plan had more of policies to provide the services, but what about prevention?
Okay, thank you so much. Going forward, it will be great for you to introduce yourself so we can know where you're from.
Okay, my question is for Dr. Leila.
Kindly introduce yourself.
I'm Kojo from University of Abuja Medical Student Association. My question is, as a medical student, I've actually, some time ago, I've seen somebody who's extremely happy, jovial, does everything normal like every other person. Then all of a sudden, snap of fingers, you hear that such a person committed suicide. So I want to really know, as a medical student, because we know what happened in medical school and how stressful it can be. How can I detect, just by seeing my fellow classmates, that something is wrong? How do I detect that this person is mentally ill? That is what I just really want to know. Thank you very much.
Thank you. You may want to make sure that we are getting around.
Hello, everyone. Hi. I'm Larissa from Cameroon. We've been talking about awareness, people being aware of mental health. So my question is, why don't we integrate health education on topics like mental health in our primary schools, secondary schools, colleges, and as you said, in our medical curriculum? Because I feel like the more we reiterate on this, the more information and knowledge gets into our minds. So I don't know if in Nigeria, in primary schools, health education is part of the school curriculum. Thank you.
Thank you. Good morning. I'm Osondu from Ibadan. I wanted to find out, you mentioned using social media as a tool in order to help in curbing mental health. But also there are the adverse effects of social media. So how do you balance that? How do you propose that we balance that, especially as a lot of teenagers now are getting into social media earlier and without proper information on how to deal with social media? Yes, basically that's my question. Thank you.
This half of the oil is not being tended to.
Good morning. My name is Zainab from University of Ilorin. I just want to say that, like always, we in the healthcare system, we are always ignored. I don't know if people know that we medical students ourselves, most of us suffer from all these mental illnesses. Sometimes we hear most of our classmates try to commit suicide or committed suicide because they failed a particular exams. Sometimes when we are disturbed or bothered, we have no one to talk to. We just push through the whole thing, and with their old stress that is accumulated upon us, we just go on till we can't take it any longer. The school does not cater to our mental health. The school does not care if we pass or fail. The school does not even want to know. Sometimes if we fail, especially maybe like mass failure, they will be like, oh, we're not serious, good for us, that they never even intend for most of us to go to the next level or pass in the first place. They say things to us sometimes that make us break down. I don't even understand why. So I just want to say, why is it that when we are doing all this mental health awareness, we never even come to us, we medical students, and talk to us and tell us what we can do to cope or to watch out for ourselves. Thank you.
Good morning. My name is Rosemary from University of Ilorin. My question is sort of a follow-up to her question. I would like to ask about mental health as it pertains to medical students. We know that medical or healthcare students have a higher risk for mental illness. My question is directed to Dr. Owe. What can be done to our curriculum to maybe relieve this stress? Because it's so packed up and there's barely any time in between reading and exams and some bad results. What can be done, maybe the federal board, the MDCN, to make our curriculum better?
Hello everyone, good morning. I'm Skari Yasir from Sudan. My question is about the social stigma of mental diseases.
I can't hear you at all.
Hello everyone, good morning. I'm Skari Yasir from Sudan. My question is about the social stigma of the mental disease. And the other question that my friend said it about engaging the education, the health education in our schools.
Good morning. My name is Daniel from University of Ibadan. A lot has been said today about integrating psychiatry as a major course in the training of medical students. Now, I know here in Ibadan, psychiatry is taken very seriously. At least it has a OMB on its own, and it is compulsory to pass it. I want to know whether the Association of Psychiatrists in Nigeria feel there's any role to play in implementing this in other medical schools and making it compulsory and at least a 3-month, 4-month posting. And if they think it's imperative for them to have a say, if anything has been done about it and what has been done about it. Thank you.
Good morning, everybody. My name is Afra from University of Jos. Thank you very much for your presentation. My question is, as Africans, most of us believe in spirituality, should I say, or culture, and most people tend to think that mental health illnesses are as a result of a weakness, maybe in the personality of a person, or lack of spiritual connection with a higher being. So how do we explain to our African people like that this is actually an illness and is nothing related to spirituality? Thank you.
Thank you so much. My name is Kawago Janvier. I'm a pharmacist. I'm from Rwanda. My question goes to Dr. Mwaniki. I want to ask, talk us about your specific project or plans to bridge the funding gap for mental health programs with governments and community-based organizations such as Smile Again. And again, talk about the conflict of interest between, with your organization, because it's a profit-oriented organization or company. So talk about the conflict of interest. Are you not doing business? Thanks.
Can we take all the questions?
Good morning, everybody. I'm Faith from Ibadan. My question is to Dr. Oweye. When defining mental health, you mentioned 4 basic things: ability to realize your potentials, to cope with stress, to work with others productively, and to contribute to the society. So my question now is, before a person reaches the maximum stage of maybe obvious mental depression, like madness or something that is obvious to everybody, these things actually start little. So like a follow-up question to what has been asked, how do we identify it at the early stage first? And how do we break the stigma? People usually do not want to come out when they have problems. And as a professional, when you see a patient and the patient is depressed or something, you referring the patient to a mental or to a psychiatrist, the patient does not want to go because there is a stigma around it. Okay, am I running mad or something? So how do we educate the populace? How do we make them realize that this is actually not a stigma, it's for your own good? Thank you.
Hello, I'm Babajide from Nigeria. I want to ask a question, naturally. There's this part of, we're all medical students, okay? And as a medical student, you probably see somebody die at some point, probably in your own hands. I don't know how it has been missed, but how has it been missed that might take something out of you? You see somebody die and nobody counsels you, nobody even warns you that once you are entering clinical school, somebody might die in front of you, somebody might die in your hands. We just miss that. Nobody counsels, nobody does anything. How was it missed?
Thank you. I'm Jumai from University of Ibadan. Okay, my question is this. What do you do when you have a friend that it's obvious this guy is having a mental or has a mental illness, and if you're trying to help him, but the person insists that nothing is wrong with me, you're like, okay, do you want to see a doctor? You should go see a doctor, or maybe go home, take some rest. But the person insists nothing is wrong with me, and it keeps getting worse. From seeing the person, it's obvious something is wrong somewhere. So what do you do when you have such a person around you? Thank you.
My name is Alorin Johnson from University of Ilorin. My question is directed to both Dr. Leila and Dr. Oyeye. If we wanted to maybe organize an advocacy program for mental illnesses, but to a rural area where they have next to no knowledge about mental illnesses whatsoever, what would you say are the most common mental illnesses that we would need to educate them about? What are the sort of trainings that we would need to give them concerning these mental illnesses and how they can cope with them? Because if we were to refer them to psychiatrists or clinical psychologists, some of them may not be able to go because of financial constraints. So what would be the most important trainings or tools that we would need to empower them with? Thank you.
Okay, we're going to hold on the questions for now, so we tend to the ones we already have, lest we miss some of them. And given that some of them have, they are quite related, so let's tend to the questions we have, and then we'll take the second round of questions. Okay? Okay. We have lots of questions here. So I'll start with Dr. Oweye. The first question was on prevention, that we've talked about the burden of mental health problems. We've talked about how mental health problems are. So how do we prevent mental health problems given the burden and the enormous statistics we have now?
Thank you very much. When you talk of prevention of mental illness, it's at 3 levels: the primary, the secondary, and the tertiary level. At the level of the primary, what you do is about educating the public about mental illnesses. How do we recognize it? Creating awareness of where to go, how to access this mental health. Very, very important. So we need to be serious about educating the populace about the mental illnesses, which is very, very germane. Now, at the secondary level, there is need for early recognition and intervention. Okay? Basic things that needs to be done, either at the general hospital level or the primary health centers. There is need for us to be able to look at this area and address it. And then at the tertiary level now, the issue of preventing complications arising from it. Because once mental illness starts, the complication could be in various dimensions. It could be in the area of physical health because of poor judgment, lack of insight, a lot of things. They may be at risk of developing many infections, risky behavior, risky lifestyles, and before you know it, this tends to affect others too. So there is need for us to do the prevention at all these 3 levels. But most importantly is the ability to recognize some minor mental illnesses and how do you recognize it? Before you can say somebody is mentally ill, there are some basic things you will see. Okay? There will be a kind of psychological disturbances that is severe enough in the individual to cause pain. That pain may be physical or psychological pain to that individual or the people around. Because sometimes the mentally ill may not feel the pains. It's those people around that will be feeling the pains. It will not allow them to sleep. May be playing music all throughout the night. It may be running up and down. So the pain may be to those people who are around him. And then the third one is the inability to function socially and occupationally. When the relationship becomes disturbed with others in the environment, you know something is wrong. When the person gets to work, you cannot function, you know something is wrong. Like you are a medical student, you're supposed to go and join your colleagues. But on getting there, you cannot function, either as a result of minor condition like phobia, anxiety. You know that there are issues along that line. So many people will not see it, but the person suffering it knows that there is pain. And that is why, for us to recognize some of these minor conditions, we have various screening instruments. And that's why we advocate, because I will take the question together, we advocate that the medical student curriculum should be looked into. And not that alone, after graduation, they should make the new doctors to rotate adequately through psychiatric posting. So that at least, just like it's able to take care of other conditions, it will be able to take care of minor psychiatric conditions. This is very important. Yeah.
Prevention, I would like to state that the social circumstances in which individuals live are the greatest predictor to their mental health problems. It is the reason that the burden of mental health is highest in low to middle income countries. High-end countries like Norway, Netherlands, where social amenities, where social amenities and social circumstances are put in place, they have higher records with mental health, with mental wellness compared to some of us here, compared to us here. So, given the social circumstance, the statistics would actually drastically reduce. And this actually took me to a question that I really missed. The stakeholders. So, for example, if we had policymakers here, they will see the impact of poverty beyond people don't have money to the fact that it can predispose them to mental health problems. They will see the impact of low educational attainment to the concept of financial freedom and then mental health problems. Mental health problems or the challenges, we cannot even discuss it. We finish it in one discourse. And for early signs, as he has said, you would still need more information, more and more trainings to be able to, because early signs for depression will not be early signs for schizophrenia or anxiety. So more education is definitely needed. So I'm going to take this question to you, Mary. Primary schools and secondary school health education, as well as social media filter, given that more teenagers are having access to social media now. How are we able to help them get the appropriate information? And also, I want you to take the question on, I'm trying to see, providing support for people who are adamant to support, because I think that was the last question we took. She was talking about how she may want to help a friend, but then the friend is not willing. So I have 3 questions together.
Thank you very much for that question. I'd like to say that social media is here to stay, so it's not going anywhere. As much as you have this, you want to use it as a positive tool, you also have the side and adverse effects of social media. So one way, you cannot actually stop these people from coming on to using the social media, using the internet. You can't stop them, but you can make them see the right thing. I know, okay, we all use our phones and we're using the internet, and you see a lot of funny pop-ups and ads that you don't even want to see. Some, you find them very annoying and all that. If you can, and I know that these things they're not just there, they're intentional. maybe they sponsor them, they make them pop up on our internet, and we just see them. Instead of allowing this unnecessary pop-up and ads that we don't need, or that are adverse effects to these people, why not have this useful or mental health issues? Why don't you have them as pop-ups? Why don't you see them as ads? Why don't you see them as vital informations that just come on your internet and then you just click on it and access it without even browsing for it? Because even the ones that are negative, you don't ask for them, they just pop up, and you find these people, just click on it and go ahead and just read. So if we can have more of this, if we can find a way to include more of these pop-ups and ads to our social media, our internet. Another thing is also, while you're trying to pass the message of using social media as a tool, you need to also educate people on cyberbullying, because cyberbullying has become very common nowadays, where people can say virtually anything without caring about the feelings of whoever is reading. You have people trolling each other. You have savage. I think it's now a trend to be savage. Everybody wants to be. It's work to be savage. Okay, so everybody wants to be savage. Everybody wants to drop their savage replies without actually taking into consideration what the other person or the receiver actually feels like. So you have someone post something, and the next thing everybody's trolling, or something happens to somebody, and I think celebrities and people who have a lot of followers actually they receive a lot of this trolling and savage comments on their post. When you see it, and you see a lot of negative comments, so you need to let people know, educate people against cyberbullying. You need to educate them on emotional intelligence, how to be able to understand people's feelings, how to be able to put other people's feelings into consideration, so that they don't use this as a wrong tool. And then also Okay, he talked about the education and policy. I think that in some countries, I know that I read on the news of recent that mental health has, they've been able to bring it into the curriculum of primary school students. That's outside Africa, not here in Africa. I didn't see that in Africa. So they've been able to add it to the curriculum and teach it as a subject to primary and at even high school level. So as they're coming up, they're getting the knowledge. They talk more about it. They talk a lot about it until it becomes very normal to talk about it. So as much as you talk about other physical, as much as you talk about physical health, you talk about mental health. You teach maths, you teach English, you teach social studies. You should also teach mental health in primary school, so they grow up with it. The knowledge, they grow up with that knowledge, so they find it very easy to talk about. It's a way of actually breaking the stigma that surrounds mental health.
Well, as a country, we're not just a country that uses or utilizes all its research. I can tell you for free that at the Center for Child and Adult Mental Health, there had been a research that has been done. Educational curriculum has been developed for young children on how to pass mental health knowledge to them. But then, all these countries you're talking about, particularly Scandinavian countries, they implement their researches. He has over 20 researches, and I'm sure that none is in the Federal Ministry of Health, because we don't implement our research. Scandinavian countries and all these countries already did researches, pilot studies, and then implemented. Here we don't. So that is totally cool. So we're going to be going to Dr. Kivwanga, and we're going to be talking about conflict of interest, as he talked about. Of course, we have to talk about it. Janssen produces quite a number of pharmaceuticals for mental health problems. Also, the fact that he was talking about supporting community-based organizations, and some of this support may not come in form of treatment. So if we were talking about prevention, it will be coming as trainings, it will be coming as other forms of therapies outside of pharmaceuticals. So how are you able to, you understand what I'm trying to say?
Thank you. I want to start, I'm coming to your, but I want to start with two questions that I really had that are very critical. One is, somebody I think on that middle row asked about mental health well-being of students and I think the concern was medical students, and with all the pressure of performing and ensuring that you deliver on that degree from your parents, your society, everyone is waiting for their first doctor from their village. Many of us seated here went through that, so we know what you're talking about. But then the big question is, as institutions at this level, you have the capacity to do something. And that's where advocacy starts. You have the capacity to do something. Most of those people you'll find are happy, and then the next day you hear they have committed suicide or they have dropped out of college, is they do not know who to reach out to because there's no system to reach out to. So as students, you can actually, you're at that level where you can start those awareness systems and support system within your colleges. And that really, I hope, should be one of the action points from this conference. Because something simple you can do, you are now at the level you can do something. You're not for tomorrow, it's for now. And I'm hoping that one of our action items is how to do that within our medical colleges and beyond, start support and peer advocacy group. The other question I had from this second row about mental health and spirituality. And yes, many of our people with mental illness go to spiritual healers, go to traditional healers. That is not surprising. In the next session, we'll talk about maternal and child health. And for many years, decades, most of our mothers delivered at home, delivered with traditional healers. The reason is very simple. We did not offer them any alternative. So if I walk to the nearest health center or dispensary and I'm mentally ill, will I receive those services? When you do not offer our society an alternative, they will continue using what they have been using, what they know of. So, and that was the emphasis on the care vacuum. You must start offering those services at the very basic level if we are to change that narrative. It's not as simple as saying, don't go to the traditional healers. It's, then what do you have for me as an alternative? We must bring that alternative. You'll be amazed. Once you do that, you'll see people, they will move to the facility, back to the traditional healer, but over time you'll see that narrative changing. Finally, the question from my best friend. Oh, is this still working? So, when I showed how to approach healthcare system, one of the central pillars is a health facility is not a building. You must have the trained personnel. You must retrain them. You must have the actual staff they came from. For mental illness, it's usually two things. It's non-pharmacological as well as pharmacological support. And that's the same for any disease, even HIV, even TB. They are coming for two things. They are coming for non-pharmacological support. That's why medical care is not about swallow the pill. And they are coming also for the pill to treat the condition. So somebody must continuously spend all the years, and I'm hoping many of you will go into research and development, thinking about what is the new innovation in treatment, where is the gap in unmet need. And in our region, and many diseases we are still struggling to even find a cure for. So that must be done, and that's why it's a principal aspect of the WHO healthcare system model. Therefore, for a company like Johnson & Johnson, we speak about it openly. We don't see it as a conflict of interest to be both a big pharmaceutical and healthcare diversified company thinking about those, and then also be a player in global public health. The connection is obvious. And if we take one of the models we have, like HIV, for many years, as our people, especially in our region, suffered and died, the world already had discovered treatment for HIV. What they lacked was crafting the necessary access models to make those treatments accessible and affordable across the world. And that's really where we come in as global public health. We are not a profit-making entity. Johnson & Johnson as a healthcare company is a huge business entity, but global public health, our role is, how do we make care accessible and affordable through the right partnership across the places where there is unmet need? And that is a big principle of public health. And That's why we are different. Within the company, we are a different company, Johnson & Johnson Global, focused and tasked to do that. But also, how do we do, the West is dealing with things, especially non-communicable and many other things. But in Africa, we still have a lot of things on neglected tropical diseases. How do we invest in research and development to discover those cures and then craft the access model? And that's where we come in as an open partner, known across the world for the business we do with integrity, but also as a global player in public health.
Health is indeed wealth, and it's no coincidence that the wealthiest nations are the healthiest nations. So according to the paper I was given, we had 2 minutes some minutes ago. So should we outrule them and just say that we still have more questions? I'm not the one. No. Okay, so I think that we may not be able to answer all of our questions, and all of our comments may not be fully addressed here. What we can do is to connect with individuals on these platforms personally. You can reach out with them, and that's one of the goals of these programs anyway. Networking is important. So you can network with them, and if your questions were not answered as appropriately as you would want it, or it was not answered at all, please feel free to reach out to any of us up here. We look forward to hearing from you, and we have had such a wonderful time. So I think we have come to the end of the plenary session on mental health. Thank you so much for having us.
Enlightening session that was. I sure learned a lot. A very big thank you once again to the moderator and the panelists. Please, a round of applause for them again, please. Kindly note that for the next plenary session, there will be a microphone stand in front of the hall. So delegates will come forward, ask their questions, and then return to their seats. Thank you very much. Now, we will invite the French interpreter to give us a quick summary of the plenary session for the purpose of our Francophone delegates. A round of applause, please.
Bonjour à vous tous. Je suis Chérif, un étudiant de la médecine à l'université d'Ibadan ici. Bon, pour aujourd'hui, nous avons notre orateur, Dr. Waniki Kwanga, qui nous a parlé de la santé mentale, briser le silence. Il a commencé par parler des effets de notre silence sur la santé mentale, sur les coûts et de la manière dont nous pouvons briser ces silences en construisant les infrastructures nécessaires à la santé mentale. So, l'engagement de leadership et de gouvernance, c'est très important pour lutter contre la santé mentale. Politique et stratégie, financement, ressources humaines, etc. Il a également parlé du plan d'action pour la santé mentale de l'Organisation mondiale de la santé, qui comprend les cibles, les objectifs et les réalisations à ce jour. Notre orateur a également souligné le fait que les financements pour la santé mentale aux moyens d'argent de poche ne sont pas viables, notant que 70% des fonds sont épuisés. En résumé, pour rompre le silence, nous devons générer une dynamique. Nous devons élever les pécheurs par le biais de la défense des droits et de l'agitation. Et de l'agitation pour les droits. Nous devons repenser le financement de la santé mentale mondiale, régionale et nationale. Soyez vocal. Parlez pour la santé mentale. Et aussi, on avait des questions, parmi lesquelles, notamment, on a demandé quels sont les défis des problèmes de la santé mentale en Afrique. Dr. Oweye a répondu comme suit. C'est le manque de sensibilisation à la santé mentale. La santé mentale implique la capacité de réaliser son potentiel pour pouvoir faire face au stress normal de la vie, la capacité d'un individu à travailler de manière productive, sa capacité à contribuer de manière significative à la communauté. De plus, le financement est un autre défi que nous avons en Afrique ici, chez nous. Comment pouvons-nous intégrer la santé mentale à la santé physique? Notre docteur Kouanga a répondu en ces termes. Ceci est en deux dimensions, car une personne ayant une santé mentale peut souffrir des problèmes de santé physique aussi. Manquer de soins personnels, tels que manquer de soins personnels, obésité, etc. De la même manière, une personne qui se présente à la clinique avec des problèmes de santé physique peut également avoir de graves problèmes de la santé mentale. Par conséquent, il est nécessaire de combler les fossés entre la santé mentale et la santé physique. Donc, merci beaucoup pour entendre cette session. À plus.
Another round of applause for our honorable French interpreter from the University of Ibadan. Thank you so much, Sheriff. Right about now, we'll be proceeding for tea break. But before we do that, just a few announcements from the organizing committee. Delegates, please, you're advised to be cautious of your personal belongings and be careful where you put them. We've had complaints of delegates forgetting their delegate bags and materials. So please be very cautious of your bags, and also that we don't have to be looking for personal belongings. That is number one. Also, for our international delegates that are also willing to change their foreign currencies to our national currency, please meet any member of the security committee and they would guide you appropriately. All delegates that have come with their personal currencies and wish to convert it to the Nigerian currency, there is provision for that. So please see any member of the security subcommittee and you'll be guided appropriately. And another delegate, Miss Dush, excuse me, there is a delegate that is looking for his delegate bag. It has Lefikaleon on it. So please, if you find it, kindly give it to any member of the security subcommittee. It was forgotten at the Johnson & Johnson stand. So if you find it, it has the name Lefikaleon on it. And we appreciate it if you return it if found. Thank you very much now. And at this point, I enjoin us all to please rise and go to the rear of the hall for tea break. Please note that unlike the time that was put on the program, tea break would be for 20 minutes because we were pressed for time. So the tea break would last for 20 minutes and we'll commence the next plenary session. Thank you very much.